Good evening, everyone. Welcome to the live injection course and the live presentation of Insulif. I'm going to give a short talk and also do a live, not a live demo, but a video demo. And I had some comments from last year wanting a little bit more of some cannula injection, so I'm going to show you my technique. I shot this for a course I lectured at it about a month ago. So for me, in 2009, what really changed my practice was the advent of the cannula. The micro cannula and the larger cannula is what I was using since 2006 for fat grafting. And I believe there is perhaps a higher safety profile based on the vascularity of the face. The concept here is that it's not monolithic. In other words, it's not just gravity, it's not just volume, but it is multiple components. And what I like to talk about looking at this evolution is the framing component of the face, which is really understanding that there is a circular volume contraction of the outer face and a volume loss around the eyes, which we'll explore more in depth, and then a volume loss around the mouth. And so this simplified illustration is what I think about when I'm talking about framing the face. So going back and looking at that evolution of time, you can sort of see this shrink wrapping of bone in these areas. And by staying in those framing areas, you can stay away from zones of dynamic issues. Lips and cheeks, I'm much more conservative about because they're dynamic problems with those areas if you overfill them. So what is facial shape? If you think about an evolution of time, you can think about where women don't particularly love the way their face looks in their early 20s or teenage years because it's too full. And so that ideal is really sort of in the 30 bracket, not always. I always say, whatever age you thought you looked the best, subtract 5 years, you're going to be too full. And if you're metabolically the same weight, you add 5 years, you're going to be too narrow. And so this concept of how we see a face and immediately have a recognition of youth is really what I'm trying to drive at. And so I'm really looking at, take a step back when you inject and look at the entire facial shape. What creates that blink effect when you see someone from 5 or 10 feet away? Another concept here is really on facial framing is this inverted egg idea. So it's a top-heavy face rather than a bottom-heavy face. And I'll show you in terms of injection how to accomplish that. But these are just philosophical constructs. So it's really just recreating a youthful egg versus the older egg shape. So if we start with the concept of facial volumization of the outer face, which to me is very safe because it's an area without dynamic issues, a lot of cheekiness issues. So it's the temple, the concavity above the zygomatic arch, and then below the zygomatic arch is another concavity. So you get this sort of concave, convex, concave pattern. And so if you can recreate a uniform egg shape or uniform level of convexity that wraps around the zygomatic arch laterally, I think it changes things. And for me, the temple is really not just the temple, it's really all the way into the hairline. And so when you start to see the shape, this is the temple, the whole side of the head. And I put fillers all the way back as need be. And then I volumize around the mouth, which we'll talk about a little bit more in depth here. So this is the breakdown of the areas. And for me, the canine fossa, if you're trying to cheat, in other words, if you don't have enough product to use in a particular patient, I just hit that upper canine area, and it really changes the whole fold. It changes the way you see the face. And a colleague of mine out of LA, Val Lambros, has done a lot of work in looking at morphing of fairer skinned women in their 20s and 30s, and then a composite of women in their 60s and 70s, and this area really depresses over a period of time, whether due to bony loss or soft tissue loss. So that's an area I focus on. And then just the whole complex, not just the marionette fold, but the complex from marionette, anterior chin, and pre-jowl sulcus. So that circle around the mouth is huge. And over the last few years, I've been very conscious of the anterior cheek. I don't put a lot in there. In fact, if I don't frame around the other elements, I rarely just do the cheek. And I'll actually inject and watch the person smile. So it gives me a better idea, and I'm looking at them multiple angles. So the eye frame to me is the most important thing because we connect with each other on a social level when we look at the eyes. Most women come to me, they oftentimes they're bothered by their mouth, but you know, the mouth, the products don't last as long the first 1 or 2 times. They take more products to deliver an outcome. The eyes can take a lot less product. But we have to conceptualize, understand what the circle is. If we break it down further, to me they're asymmetric triangles. And so what is this? So what it is that when you start to think of lateral brow ptosis, if you start to fill this A-frame deformity, in other words, the medial short limb of the upper eyelid, you frame down the eye and you actually create a more horizontal aspect of the eye. So I'm trying to take these asymmetric triangles and make a horizontal frame to the eye. And that is really one of my major goals. This is just showing you a 49-year-old lady with volume around all 3 circles that I talked about. How do you do it? So with fillers, I'm going parallel to the rim. With fat, for the lower eyelid, I'm going perpendicular. I just threw that in there just as a point of contrast. But the fillers, I enter from those points where there's a dot, okay? And I just build that. And occasionally I'll come back and I'll fill with fat a little bit more on the lateral canthus. But I also do that with fillers. I'll come in and look for shadows. The more you train your eye to see shadows, the better. Fat, I don't get up right up to the edge of the margin of the eyelid, but I can with fillers if you're submuscular and deep enough so you don't tyndall. But you got to be really, really careful to do this and very slow in your injection process. So it's a complete frame to the eye. The mouth frame I've already talked about briefly here. Here's about a 10-minute video that will walk you through in a real-time fashion a periorbital injection. Again, this was shot for a previous course. This is a lady that's 36 on the left and 42 on the right, so she's been with me for a while, and I just slowly built her and built all the areas of the face. So this is not just one area, but the entire face, including lips and everywhere. This is a lady that's actually gained 10 pounds on the right, but I underwent botulinum toxin injections in the masseter to help slim her face, as well as a little bit of volume around the eyes and the jawline. This is a lady, she has a little bit more makeup, I apologize, but you can really see the temple and the reshaping of the face from the sort of collapsed trapezoid type shape into an oval. This is one of my medical assistants, and this is really creating a better oval shape. If you really start to see those 3 circles I've told about. There's a lady that's early 50s on the left, mid 60s on the right, just slowly being built. She had over resected eyelids. And this is just a gradual process of bringing, you can really see how she's bottom heavy on the left and top heavy on the right. Asian eyelids that begin to create multiple folds as they get older. If they've had a fold in youth, what this is just a partial crease, and you can add volume back in to the eyelid very carefully. This is done over 3 or 4 times. You want to be really slow in the process. And then this is just that reshaping I told you about. You can see the triangles up there, and then that's more of a horizontal eyelid. Sometimes a facelift, rhinoplasty, fat grafting, laser, in complement to Botox is what you need. You just can't get this all done non-surgically. Same thing, eyelids. This one had eyelids, rhinoplasty, lip enhancement with fillers, laser, acne scar correction, facelift, etc. So you can't do everything through fillers, but fillers are a great complement. I don't have any financial affiliation with this course in November. I would love for you guys to come if you're interested in hair. It's a very hands-on process, and I will give you passion in what you do. You're not going to just walk out trying to make more money from this, but you're going to love hair if you come for those few days. I close out with just encouraging all of you to really see better, think more, and don't get bored with filling. You constantly, every day is a new challenge for me. It's constantly thinking and reinventing and learning from my colleagues and all that.